The EndoRotor is an interventional resection device to be used during endoscopic procedures by a trained gastroenterologist or interventional pulmonologist. The EndoRotor has several cleared indications for use. Consult instructions for use on EndoRotor contraindications. The EndoRotor endosurgery system consists of a console, foot control, vacuum pump, and catheter. Ensure the correct catheter length is selected for the appropriate scope. The catheter requires a 3.2 mm endoscope working channel. If you have additional questions on the catheter selection, please consult the EndoRotor Instructions for Use Endoscope Compatibility chart. Ask the physician if the procedure is a powered endoscopic resection, tissue collection, or powered endoscopic debridement, no tissue collection, and select the corresponding in-service video. The PER catheter has a bevel tip, comes in various lengths, and facilitates tissue collection. All catheters require a 3.2 mm endoscope working channel. The EndoRotor PER catheter is available in the following configurations. For PER procedures, the following disposables are required: specimen trap with preloaded filter, a bag of normal saline, 250 milliliters to 1,000 milliliters, suction tubing, and suction liner for the independent ER vacuum. Ensure the catheter interface on the console is in the unlocked position. Insert the catheter's proximal housing into connection. Ensure hex connection aligns. Gently push catheter's housing completely inward and rotate locking lever right into locked position. Maintain forward pressure when inserting the catheter. On the bottom surface of the proximal housing are two connected tubing sets. The shorter of the two tubes is the specimen trap connection vacuum tube. To load, press the vacuum release button. Stretch the tube and place into the vacuum release valve until seated. Take care when stretching the tubing to ensure your right hand does not hit the catheter housing with force. Hitting the housing with force may damage the catheter. Connect vacuum tubing directly to the top section of trap with a press fit until firmly seated. The bottom section of the specimen trap must be connected to vacuum tubing. Remaining tubing will be connected to an independent vacuum. Activate the independent vacuum by pressing the bottom right power button once. Control the suction by turning the dial clockwise, counterclockwise, referencing the inner orange numbers. It is important to confirm vacuum settings with physician. For a procedure in which tissue collection is desired, the vacuum should be 50 millimeters of mercury and can be increased as physician feels appropriate during the procedure. Do not exceed 250 millimeters of mercury. Use a vented spike on irrigation tubing to attach to the saline bag. Open the irrigation pump by lifting irrigation hood. Place irrigation tubing set on top of rollers and pump with flow from left to right, then close irrigation pump hood. Press the prime button once. After prime is completed, the amber light turns green. Submerge the tip of the catheter into a basin of water. Tap the left pedal once to activate the blade. Then press and hold the right orange pedal for 5 seconds to allow additional irrigation into the catheter. Lastly, release the orange pedal and deactivate the catheter by tapping on the blue pedal once. The catheter is now set up for the procedure. Maintain sufficient distance from the console so that the flexible outer tubing is as straight as possible with no kinks or coils. Failure to do so may affect performance. If performance is affected, then straighten the outer tubing and operate the device. The angle of the catheter should be at no greater than 90 degrees when entering the working channel of the endoscope. After the procedure, with tissue collected in the specimen trap, ensure that there is no remaining tissue inside of the catheter. Place the catheter tip into a basin of water. Activate the blue pedal and press down on the orange pedal for 10 seconds until the line is clear of debris. Disconnect the vacuum tubing and ER short tubing from the tissue trap. Once specimen trap is disconnected, give the tissue trap a slight turn to remove the filter screen. Place the filter into a plastic container containing formalin or tissue fixation solution. Discard all disposable components upon completion of the procedure. Do not discard the reusable plastic canister, vacuum overflow canister, and attached short reusable tubing.